these days it's not so good.
Good evening. Welcome all of you joining the virtual presentation for the security during the unsecure times surviving a pandemic, organized by the Occupational Health Center. Today, we are so pleased to have Sandy Forcier, the union representative from the United Food and Commercial Workers Union, Local 832, to present it for us. We would like to begin by acknowledging that we are on the Treaty 1 territories, the traditional territories of the Sinebek, Greek, OG Greek, Dakota, and Diné people, and the homeland of the Métis Nation. We respect the treaty that we were made on these territories, and we acknowledge that we are treaty people. At the Occupational Health Center, we commit ourselves to a process of reconciliation with Indigenous communities. So for the audience participants, you can see that you are on mute as a default, but you can unmute as needed to say you have any questions to ask during the Q&A session. The question can be asked by the chat box section on the right side of your screen. So, or you could raise hand on the screen. I could see you there. Then you, if you're unable to type in the chat box, and we will ask you to unmute yourself to raise your question in the Q&A period. So our session is being recorded, and we will try to post it on our website and social media sooner or later. So you may not know about the Occupational Health Center. We are now located on 167 Sherbrooke Street. So we are the community health center funded by the Winnipeg Regional Health Authorities. We provide the services to the Manitoba workers with work-related health issues and work closely with the John's Workplace Health and Safety Committee for training. Please visit our website for more information and the resources. Now, please join me to welcome Sandy Forcier to give us the presentation.
Good evening, everyone. I'm just kidding. I don't really talk like that. So yeah, my name is Sandy. I'm union representative of the United Food and Commercial Workers, Local 832. I've been a staff member here for 17 years, going on 18 years now. I do come out of the packing house sector originally. And now I have security as my primary territory with a few small industrial units. So before I really get into the crux of this presentation, I just wanted to give a brief overview of the security industry to those folks who may not be familiar with it. So the security industry is a highly competitive and low margin industry. Companies bid for work at client sites and they will underbid each other to get that work. I sometimes refer to it as a race to the bottom, if you will, to acquire work. And through this process, clients possess a lot of power over the employment of our security officers at their sites. They dictate rates of pay by the bill rates that they negotiate with the security companies, and they are dictating what services and what work is performed on their work sites. So that there is already a hurdle for us to deal with, whether it's pandemic or not. Security guards, some of you may or may not know, have to do required 40-hour mandatory training, which they have to pay for. Once they do that 40-hour mandatory training, they then have to write a security exam, which they have to pay for and pass. Once they have done these two things, they can then apply for security work, as well as applying for a criminal record check and a child abuse registry check. All has to be in place before that they can apply for security work. So with that, I'll get into sort of the presentation now, and I'll start off with the review of the timeline. So as we all know, in late 2019 and early January, we started to hear of what was happening with COVID-19 in China, and then very rapidly and quickly moving through Europe and making its way here to North America. It was in, I want to say, early February or so, we started to hear of the first cases in BC and in Quebec and in Ontario, and then quickly moving into Alberta and the Prairie provinces. Here in Manitoba, we started to see our first cases in early March. And then we went into our, what I call a quasi shutdown here in our province, with only essential service businesses operating from the period of March 20th to around May 27th. Security was deemed to be an essential service during this time. And while other businesses were ramping down or laying off and closing shop during that period, security got busier. And security companies were hiring for people to cover, properties where businesses were closed and stuff like that. There were a few sites that laid off, such as the museums, the libraries, and those sorts of places. And our Winnipeg Parking Authority folks, some were laid off as well, as the city relaxed parking bans during the day as more and more people were working from home. So that would then bring us into, early June, where things are starting to slowly open up, for July, and then summer hits and we're kind of wide open and just doing our social distancing and hopefully wearing our masks. Throughout this whole process, security continued to work. Security dealt with the public's I will say issues and anger with their lives having to change, and enforcing public health orders such as social distancing, lineups you would see in the news at retail grocery stores. It was our security folks, that were managing that, and the numbers that were entering the stores at any one time. They were dealing with the customers getting upset. I've heard stories of security guards being called racist because they wouldn't let a customer go forward as the count in the store was already full and they had to wait. I heard from our Winnipeg Parking Authority folks that they were being spat on by public when issuing tickets. And we know that this disease is airborne and stuff, and then here we hear of people being spat on during this time, which was just ridiculous in my view. We also heard about issues that were going on out in Quebec at the Walmart store in particular, where a security officer was struck by a vehicle for not allowing both people in the vehicle into the store at the same time. So these were the issues that we were dealing with. Our security guards were dealing with PPE issues as well. I just want to make sure I'm not missing anything here. No, I haven't. And then obviously we were dealing with a lot of fear. As I said earlier, when we thought things would slow down, this territory was slow by no means, and I was probably fielding about 70 to 75 calls a day just regarding COVID and whether or not someone had to go to work. And as we know, it was deemed essential, so yes, they had to go to work. Fear was not a reason for them to be off work. That said, I recommended to folks who may have had some underlying issues just to get a doctor's note to say that you have underlying issues and are high risk to have that time off. And then the questions came in abundance regarding CERB and whether or not folks were eligible for CERB, and we had to go through all that process with folks. And then shortly after that, towards the end of March and in June, we entered into the risk recognition program that was program put together with money from the federal government and provincial governments. So we had to lobby to be on the committee to discuss which frontline workers would be eligible to receive that risk recognition monies. And our president, Jeff Traeger, was on that committee and obviously was successful in pushing for our security guards to be recognized um, to receive this money. Now, had President Traeger not been able to do that, I fully believe that our contract security officers would not have been covered by the risk recognition program. I believe the government was only looking at in-house healthcare security as frontline security workers that would have received benefit. Um, and that was quite evident in the application process, which evolved and changed over the first few days of us contacting them to say, hey, these folks can't apply because of the restrictions you've put in place. So that was there. And then we were dealing with the constant changing of the recommendations in place. I know early on we would have heard that the social distancing was recommended protocol of the 6 feet or 2 meters. Wearing a mask was not mandatory and not necessary, and constant washing of hands and sanitizing were the key recommendations at the time. We had a lot of members obviously worried and concerned that they may be doing that, but others out in the public were not, and they were at risk of contracting the virus. So we were talking to the employers about the PPE issue, and we could see early on that proper PPE wasn't going to be provided because it wasn't mandatory, it was only recommended. So we did purchase some face masks for our guards and some personal hand sanitizers that I'm still in the process of handing out to guards right now. And I think that that's sort of the timeline of things, and we get to present day and we know the situation that we're in now. And if our members were fearful in the beginning, I can only imagine how fearful they are now, considering the numbers and the rate of that this virus is spreading. I have no doubt in my mind that we will see our numbers reaching 5,000 cases here in Manitoba by the end of this week. No doubt whatsoever in my mind about that. And our death rate is increasing, as we well see. And our members are still out there working hard to not only protect our property, but us from this virus and ourselves, I'll say. So with that, I think we can move on to the next slide, please. So the biggest issues and challenges that we face during this pandemic was one, obviously, PPE. As I had stated earlier, our members were lacking the PPE. Members would call me and say, we don't have it. I would have to call employers to get simple things, such as gloves and making sure that there was enough hand sanitizer or access to soap and water for our folks to wash their hands and wipe down their work areas and high contact surfaces that they would come into contact on their work sites. So that was a huge issue for us. The other issues that we had obviously were rates of pay. These folks did not receive any increased pay during this pandemic that we've seen other folks receive, such as retailers and some of the warehouses and things like that. These folks continue to work at their salary without any extra pay during this time. A large number of security guards making the minimum security guard minimum wage, which is $12.50, and some making $13. So really not being paid enough for what they're doing and the risk that they put themselves and their families through to serve and protect our property and us, right? So the other issues that we face is mental health issues. Workers are filled with anxiety. They're they're filled with fear. A lot of workers were, like I said, contacting us to say, hey, can I have the time off? Do I have to go in? And I firmly believe that this is one of the biggest issues and areas that we are going to have resources in place for coming out of this during this pandemic and coming out of it. Workers are going to be suffering from mental health, from the anxiety, and pressures put on them to do extra work at work. Security guards weren't just doing their regular security work, as I had stated. They were also now tasked with extra cleaning duties of work surfaces and sanitizing, etc. And in large part, in my view, without proper training and proper information on the material data safety sheets for the chemicals and products that they were using to do those duties. I think we can move to the next slide. So here, I have some attachments throughout this presentation to sort of discuss and show what we have done during the timeline here as well. So here is a letter that was sent out from our president, Jeff Traeger, March 23rd, you can see. So right when this was all sort of coming down and hitting the pipe. And it was out to the security guard companies, and it requested some specific information from them. It requested their pandemic plan and how that they were going to, address workers' safety on the job, how they were going to address, employees required to self-isolate, the wages, the health and safety concerns. Were they going to have access to washrooms and facilities for regular hand washing, all sorts of things, right? And you'll see them listed there. I can tell you, folks, that we heard from 2 of the 5 unionized companies that we represent in security that provided a pandemic plan, and also didn't confirm or guarantee that there would be increases in pay, but did say that they would look to negotiate higher bill rates with either new clients or existing clients that had expiring contracts. And if they were successful in doing so, they would pass those increases directly on to the security officers at those sites. I haven't heard of anyone receiving that, so that had not come to fruition. So if we can move to the next slide. So what this here is just from our own UFCW 832 website, and it is a COVID-19 security Q&A. So right from the beginning, we tried to draft some questions that, I was fielding as a representative, and put some answers down there so that our members would have access to that, and hopefully have a better understanding what they can and can't do during that period. Things of, can I go on a leave of absence, and will my job be there when I return? What are the risk factors, or do I have childcare issues? Do I have to go to work? All these things. And you can see the list of the questions there. Can I refuse work? And obviously you can refuse work, refuse unsafe work at any time, but you have to go through the protocol. This sort of explained and answered those questions. You can see, do I qualify for CERB or EI? And am I required to, or is my employer required to provide me with protective masks and or gloves? And at that time, it wasn't a requirement. It would have been just a recommendation, right? So that was there for our members to hopefully provide them with some answers. And if we can move on to the next slide. So this document here was an op-ed that we put in the Free Press. I want to say it was around April 24th, something like that. And really it was about trying to enlighten the public of what security guards do in their role as security guards, and the issues that they face on a daily basis You'll see if you scroll through the letter, there's their comment about, you know, the Quebec Walmart that I spoke about earlier, and also commenting on the issues that our own folks were facing with being spat on and called racist, etc., enforcing public health orders. And really, this was a call to the public to respect our security guards. It was also a call to government to hopefully have them understand the role of security, because I don't think that they do, at least not contract security. And it was just a reminder to everyone that these folks are human, just like all of us, right? And should be treated with that same respect. They're doing a job and they need to be respected for that. It also forms part of a larger strategy with security that I'll get into a little bit later on. So if we can go to the next slide. So this now is a letter to Brian Pallister, again from our president, Jeff Traeger, and it is talking about the risk recognition program and calling out to him, or to Pallister and his government, to really start to take a look at the training that our security guards get, the wages that they receive for what they do, and ensuring that they're included in the risk recognition program. So if we can go to the next slide. So this is a reply to our president, Jeff Traeger, from the provincial government on June the 25th. And basically, this letter basically says that they would have the registrar of the Manitoba Department of Justice overseeing the security guard program to be in contact with us and start to talk about some of these issues. And what it's done is it has opened the door for us to now start to review the 40-hour training program, which our local was heavily involved in. Ms. Jones is on this call. She was heavily involved in that process, contributing information and putting the program together. And we did a lot of the printing and stuff like that for that. So now we're looking to review, because really the goal was to review this every 5 years and update as necessary. And that hasn't happened, I don't believe, since like 2005 when it was first implemented. So we go to the next one, please. So this is a worker that, a sheet that was put together for our security workers in conjunction and partnership with the Occupational Health Center, who had reached out to myself to provide some information for this sheet. And it's a fairly in-depth information sheet that provides a lot of information to our folks in the security sector. I'm not going to touch on every single point of it, but it does go through the whole gamut of cleaning and sanitizing, disinfecting, right to refuse unsafe work. It touches on, you know, proper ventilation and things like that. As you can see, other important workplace practices. So it's a very good tool. This information sheet is up on the OHC website. It is also up on our UFCW 832 website. And I have recently forwarded this document to the Security and Private Investigations Registrar for the Manitoba Justice to hopefully have them posted on their website as well. So not only, unionized security workers will have access to this information, but regular security folks who aren't unionized would have the same access to the information as well. We can go to the next slide. So this slide is very important, and it's near and dear to my heart because this is a slide regarding our security empowerment project. One of the first things that I had realized coming into this territory roughly, I don't know, 18, 19 months ago, no, 22 months ago now, is these folks lack one word, and it boils down to respect. How to get respect is that people have to know what these folks do. They have to know the training or lack of training that they have to do the jobs that public expect them to do. And they need to know and understand the wages that these folks earn for the jobs that the public and security companies expect. So how we're doing this is through our security guard empowerment project, where we're setting up guard leaders through our own security folks. And we're trying to identify and prioritize their training needs, not the training needs that I think they may need to be successful on the job, but what the experts feel they need, because they do the job every day. We're trying to organize and advocate with community groups and other labor groups to share and spread the information to try to help get these folks the things that they need in terms of training and wages and things like that. Yeah, so there you can see we have a quite lengthy survey on our website for our security guards to fill out, and we're going to use that information to pool it all together to figure out the best strategies to move forward and how to achieve the training needs and the wages and working conditions that we're looking for our security folks. And there's also Join the Security Guard Facebook group. And really, we want our security guards to join it, not friend it, join it, because friending it, when you share a post, we see everything that you're posting. So we just want you to join it. And then other folks, such as our friends in labor at the Occupational Health Center, the Manitoba Federation of Labor and stuff, obviously we're going to have them friend our group because we want them to be included and share their thoughts and ideas as well. So if we can have the next slide. So this sort of brings us into a new realm, and I'll tell you how I think this connects to COVID. So back in January of 2020, our president, Jeff Traeger, was involved in discussions on a committee that was to deal with the retail crime that's happening in the city here. We know with Manitoba liquor marts, there was a big issue with theft and sometimes violence and stuff like that. And there was a program implemented where now all MLCCs have glass vestibules that our guards are behind and safe, and basically card checking and ID checking folks to allow them in the stores. So with retail crime on the rise, it was thought to put this task force together to try to address these concerns. Our concern is that we were at the table when these discussions started, but when the task force was put together, workers in the fields didn't have their voice at that table. It is security guard management folks that are on that committee. It is law enforcement folks that are on this task force. And it is retail management folks that are on this task force. And where are the workers on this task force? Nowhere. So this letter was our plea to the government to say, hey, we were involved in the beginning and now we're not. Where's our voice, and how are our workers who are the experts in the field, how are their ideas and thoughts going to be expressed and implemented in what will take place in the future? So if we go to the next slide. This is the response to that letter sent by President Traeger on the Retail Crime Task Force from the government. And it basically tells us that the co-chairs of the task force, who are Shannon Martin, MLA from McPhillips, and John Graham of the Retail Council of Canada, would be contacting our president to have some discussions around that. I'm happy to report today that we found out last Friday, I guess it was, that we won't have a voice at the table, but what this task force has committed to is that the recommendations and report that will be provided from this task force will be vetted through us first. And if we have any input or changes or whatever, we are to give them to these folks at that time. So not a direct voice, but still the ability to have some indirect input into that, which is better than nothing for our workers. Okay. We can go to the next slide. So, well, I'll just, before I start this one, I'll say the connection to the retail crime task force for me and COVID is that with this pandemic taking place, without our security folks or even our retail folks having a voice at that table, no one really understands the health and safety risks that these folks experience during these times dealing with these issues. And that's our biggest concern and fear, is that our folks' health and safety is not going to be at the forefront of these discussions, and that it's going to be, how do we prevent losses in our stores and et cetera, things like that, right? That's a business focus. It is not on the human lives that are performing the work. And that's the relation to COVID here. And not only just to COVID, but with or without a pandemic, we're focusing on the health and safety of our members through that initiative. Moving on to this slide. This is very, very important slide. This is a letter that is going out, and we're asking our security members to sign, and this letter is going to go directly to their MLAs. And it's, again, it talks about inadequate training and equipment, and it's time for an action. And we want to reestablish the security guard minimum wage that Mr. Pallister froze in 2017. So this is important. And I can also tell you folks that we've drafted a very similar letter that we will be reaching out to the Manitoba Federation of Labor to disperse through to all the labor affiliates, so that they can have their folks sign this letter as well, and in support of the improved training and wages and working conditions for security guard workers. If we can move on to the next slide. So we're at the Q&A, but I just want to review my notes, if you don't mind, just to make sure that I didn't skip over anything that I wanted to share. I guess the only thing that I want to share here is that I have to give a lot of credit and kudos to our members who have engaged and participated in our security guard empowerment project to date. They've done a lot of work in giving us ideas. We spent a lot of time with those folks, and Dorothy Wigmore from who was working with the OHC putting together the information sheet also helped us and did some training on body mapping to recognize dangers and risks, and how to deal with them before they become real issues and concerns. and also did some site mapping with us, again, to recognize hazards and dangers in the workplace and ways to address them before they become real concerns. And we've been running a few phone banks now to reach out to our members and get them to sign this letter. And Daniel, I see Daniel's on the line right now. I know he's been out to a couple of them, phoning and getting people out. And Debbie and Tim have been out and participating and getting folks on board with the program. And we're going to look to develop a lot more things going forward. So that, folks, really is the timelines, I guess, and what we're doing and what we've tried to do during this pandemic with our security folks. So with that said, I think we're a little ahead of time, but we can open up to any question and answers. And this is the part for you folks that I look forward to the most, because one, it challenges me, and hopefully it opens me up to new thoughts and new ideas in terms of trying to assist our members. So is there any questions? Any comments? You folks?
Any comment, question you want to ask Sandy? Or we could just let you speak on your screen instead of putting comment on the chat box. You're welcome to do so.
I was going to just say that you folks aren't going to let me off the hook this easy, and I wasn't that informative that I gave you all the information, was I?
Yeah.
Nobody wants to talk today.
Can I speak?
Okay, Monica.
Yeah. I have already put my question on the chat box. Have you seen that?
Oh, I'm sorry. I may miss that though. So would you mind to just raise the question here on the screen? So
yeah, I can. See, I have seen a long queue for, screening at the HSC. Yep. People are waiting. I don't know, there are less security guards there or what is the reason, but it takes time and there are people. And this weather, now we are having even this snow, apart from minus temperature. Standing outside for hours is little difficult. People are agitated. They take advantage of whosoever is dealing with them. And the burnt is the security guards, So my suggestion is, have you ever noticed that? Or have you also thought of increasing the staff so that this can be handled in a very, timely manner? People are not to wait too long outside.
Good question. And I don't have the right answer. The right answer would be that, yes, there would be enough staff in place to handle all those issues and move folks through quicker through the process. I will tell you that HSC and the other hospitals, the folks that are doing the screening are not our members. They are in-house security folks hired by the RHA in that facility to do that. Our guards at HSC are assigned different things, such as, when you're coming in the entrance, making sure that you're going to the right place, making sure that you're sanitizing, you have a mask on, that kind of stuff. They're not actually doing the actual screening of folks. So I don't know if that answers your question, but I do know that you're right.
Thank you. That answered my question, and I get myself corrected as well because it is being handled by some other agency. Yes. But this is a pity that there should be someone who should look into it.
No, I don't dispute that. Unfortunately, I will say I don't have a lot of faith in the agency that should be doing that, and I think we know who that is. That's the folks who are running the show on Broadway, right? And I know that going into this season in particular, no one likes Winnipeg winters. We can see the white stuff falling again today. Nobody likes that. Nobody wants to be standing in line. I'm one of those folks that don't like to be standing in a line when it's 30 degrees outside either, right? I get very irritable and stuff. And yeah, you're absolutely right. It is our security folks that are going to be dealing with that. They're going to become the complaint department too, right? And that's where I focus on the whole respect issue. That one word, respect. They have a job to do. Respect that. Let's move on. They're not the ones who are saying it's got to take this long for any process, right? They're the ones who are assigned a job and they're doing it. And that's really what I can say to that. Again, it's going to be up to the government and the RHAs to make sure that they have proper staff in place to do the proper things. I can tell you right now, even to get a blood test these days is ridiculous. You have to book an appointment online since they've given the monopoly to Dynacare. You know, and they've closed facilities, labs around the city, and it takes you 3-4 days just to book an appointment to get in for a simple blood test now. And who's going to be monitoring those lines in wintertime?
Thank you so much, Mr. Forcier. I'm really honored that you have answered my question.
Well, that's good. I hope I was thorough enough.
I have a comment. Sandy, actually, it's Monica asked great question. It's when people I have seen even in the grocery store line, you know, when people like there is no security officials or anything, but when the in-house people around I saw, but it goes on them, right? Whoever the managing the line or whoever, then I can't imagine about the responsibility for the security officials. It's so much. And then they are with the fear and everything, it's on top of that. I heard few stories through my own community, and I invited few to these sessions. Some mentions they already got some information and training, and the might be true. So it's a huge thing, a huge issue. I'm glad that the Jeff Krager and you all with MFL, it's working on that. It's newcomers population is in this job so much, and I appreciate that. So all the effect to take some kind of uplift and improve the sector, it's great during this this difficult time.
Yes.
Greatly appreciate, but I know a lot to improve, and we know it can do overnight, but still appreciate all the effect, like we try,
Well,
right? So
yes. Well, and thank you for that, Geeta. And you're absolutely right. We do have a lot of newcomers and new Canadians in this sector. It is why, and I didn't touch on it earlier, I apologize. The sheet that the OHC put together, the information sheet with some help from myself, was translated in several different languages. And sorry, we probably skipped through it and didn't see that, but we know that our membership is diversified. And, you know, if we put something out in English, we're not hitting everybody, you know, and we're leaving a very big sector of our members and the workforce out. And that can't be accepted or tolerated, right? Everyone has the entitlement to the information to keep themselves as safe as possible. So we are going to continue to do that. It's why also during our phone bank to get people involved and signed the letter to their MLA about the working conditions and the training and rates of pay. We have folks who can speak different languages to reach out to those members, because as much as I want to be there to help members, when I call someone who struggles to understand me at the other end of the line, or I struggle to understand them at the other end of the line, there's already a disconnect where that person on the other side of the line has to warm up to me and think that I am the person that they can trust to communicate with, right? Whereas if someone who can speak their language and says they're from the union office and they're calling, there's that almost immediate connection, and the trust is built, and they can say, hey, this guy is our union rep, right? And we have to go through him, and he's going to try to help us as much as he can. And that's what we're trying to work on, because we know in this industry there is a great disconnect, and that's not to the fault of our members. It's truly not. And I would never ever think that, and I would never ever say that. It's the structure of the industry they work in. There is 5 unionized companies that we represent. These companies have hundreds of sites throughout the province. I physically can't see them all. Maybe throughout the course of 5 years I can, but over a short period of time, there's no way, right? So we're trying to find a way to build bridges to close those gaps and be able to share the information and hear from those folks. And that's really what our security project is about, and what I hope to continue with it, and not just get to a point where we're comfortable and we have 40 guard leaders who are reaching out to people, but I'll feel comfortable when we have 2,000 of our members on board, all doing and fighting for the same thing. That's when I'll feel comfortable.
Yeah. So Sandy, I got Dave from the audience raising a hand to want to talk.
Sure.
Can you unmute yourself, and you could talk to raising your comment and the question?
One of the things that is most disturbing about this industry is that our employers are now target hiring from new Canadians. And it's very disturbing to see, because it's much easier to push those employees around and for them not to stand up. So it's important for us to have people like Sandy who can reach out and tell them that, you know what, you do have rights, and the union will be there with you while we empower them to stand up for ourselves. And that's part of what our empowerment project has been about, is teaching guards that you have a voice. Sometimes you just need somebody to stand beside you while you exercise that voice, and UFCW is always going to be there. So it's really nice to have that, and to be able to have the OHC help us with those sheets and have them in multiple languages has been so valuable for us to be able to teach our members that they do have health and safety rights.
Absolutely. And if you don't mind, I just want to touch on what Debbie was talking about, and I'm going to give you an example of what she's talking about that's fresh in my mind from me trying to deal with some of it today. She's absolutely right about the target hiring with hiring new Canadians, and that already is going to put some folks at a disadvantage. We know that folks are here, they're trying to work to get their permanent residency, and they become loyal to their employer because they want to be able to get that letter from that employer to help them get that PR after the 2 years, right? And I can understand that. I can. But along the way, we don't want these people to be taken advantage of either, right? And we need to find a way to make these folks feel comfortable. And why can't we get to a place where the union can write a letter for these people to get their PR? You know what, this person's been a member with us for 2 years. All my experiences with them have been fantastic. They haven't caused any problems at work. They contribute to our society. Why can't we do that letter? That's where I want to get to a place too. And the example of the target hiring and talk about training requirements and lack of, I got a phone call from one of the employers today. They've acquired Parkview Manor, and we all know the issues that Parkview Manor is facing right now during this pandemic. It is an absolute, for lack of a better term, hotspot during this pandemic right now. A lot of cases, a lot of deaths in that facility. And this company has now acquired this for security services, where there will be 54 security officers working at that facility, 7 days a week, 12-hour. They're going to work 2 12-hour shifts. They're going to have 7 days on, and then they're going to have 7 days off. And so my first thing to them is that, so what training have you given them to enter into this facility? You know what is happening there. What's their role going to be, and what kind of training are they going to have? Especially when you're telling me that you have to have 48 of them ready to go next week. HR has spent the first half of this week hiring 28 new people. 28 new people hiring. I don't know if these people are newly certified guards, if they have experience or not, but they're walking into a landmine, in my view. And without the proper training to do so, how many of these guards are going to end up contracting this virus and potentially spreading it to other people? So it's a huge concern. That's why we're doing the things that we're doing. And again, Deb was absolutely hit the nail on the head. They are target hiring because they know that they can try to take advantage of these people for at least that first 2 years. It's a shame. I never want to accuse anybody of doing it, but we see it. So
I would love to share with you some resources and column we have been create on our OXC website. So under the OXC website, this is, you can see on the menu here, the COVID-19. So the resources related to healthcare, income support, rent payment, emergency housing, food support, and domestic violence. And over this, on this menu, you could also see the workers' mental health support, social distancing for workers, at-home ergonomics, information sheet for essential worker, that's including the security guard one, and then the safer cleaning practices for the workplaces, use your workers' rights to protect yourself, ventilation resources, and the webinars. Webinars, yes, that means, any recorded webinar probably we will be posted on this section. So when we back to the information sheet for the essential worker, then you can see we have created, for different sectors. So like not only the security guard, but also the cleaning and janitorial workers. Some languages is available, is listed here. And then grocery store worker, and then we have Mandarin and French has been translated. For the meat poultry processing workers, Hindi, Mandarin, Spanish, Tagalog, and Vietnamese. And the security guard, Sandy just mentioned, we got Arabic, Hindi, Punjabi, and French available. So if you have time, please visit our website for more all those resources, and you could pass it on to any members, any friends you think they're working in the industry right now. So now it's about a few minutes to wrap up. So do you still have any comments and any question to Sandy, or you want to share with the group here? That'll be, you feel free to do so.
if you don't mind, I'd like to use 3 minutes and 59 seconds of that time just before we say bye. No, I'm just kidding. But I do want to make a couple of comments because I'll be remiss and I'll regret it that I don't say it. So first and foremost is thanks to our members in security for doing what they do and providing us with information to help assist them and others in the industry. Second is I do want to thank the OHC for all of their work, reaching out to us to ask us to do this presentation. It's not only for security members, but for others who want to listen, and hopefully they get some information on maybe what we're doing and try to address some of these issues, and maybe we help other unions or other workers navigate through similar issues in their workplace and give them ideas on how to do that. I want to thank Tiffany, obviously, for reaching out. I want to thank Tiffany and the OHC and Dorothy Wigmore for reaching out and putting together the information sheet. Again, it's a great tool, and hopefully we can get it out to as many folks in the industry as possible. And then I will leave it and thank you all for participating and for your comments and your questions.
So do you have Gita?
Yeah, I wish there were, actually, I'm glad Monica is one of our community trainers from East Indian community. Actually, I'm glad to see her. This is like a very busy time. I expect more community trainers representing other communities today. I'm sorry to say it didn't happen, but we will share your presentation, Sandy, with our groups. At least they are informed and get your contact information to
Sure.
share with their communities. So I'm glad about that. So
I appreciate that. And I do hope that you folks don't mind me calling you and bugging you, because I have some big thoughts on how some things that I would like to do, and I can definitely use your expertise and involvement in those areas too.
We are happy to connect with you and to improve the health and safety for all, right? So yeah. Thank you.
I would like to say one thing, that in my community, there are quite a few who are also in this profession.
Mm-hmm.
I'll see sometime this, actually I am into other areas, working into other areas, so not getting time, but definitely I will include people for the community workshop,
Oh,
those
yes.
who are working in the security sector.
Mm-hmm.
That's great. That's great, Monica. Yeah.
That is great, because the other thing I didn't mention is that there is a lot of new Canadians and immigrant Canadians working in this sector who aren't here right now because they're stuck back home due to travel bans and stuff. We have members in India and Pakistan and in the Philippines who are stuck and can't travel, right? So very, very difficult times for them as well, because they're not earning any money while they're there, and nice to visit family, but not nice to be worried about your house and rent and stuff at home.
Yeah.
So.
Paycheck.
So on behalf of the Occupational Health Center, once again, thank you all of you joining with us to spend a whole hour to sharing your comments and put up the questions, to asking us, about, all about the security sectors and the COVID-19, all those information. And once again, thank you, Sandy Forcier and the UFCW have been really supporting us, to put this information together. I really appreciate your time and effort. I know now you guys, is the most busiest time of the year for you to work on, to giving all the support, to the members. So I really appreciate that you have been working so hard to support all the essential workers, helping out there, and making the community safe, right? So wishing all of you have a great evening, and then stay well, stay safe, and take good care of yourself. I hope we will see you the next coming up session. Good night. Bye-bye.
Good night. Stay safe, everyone.
Bye.
Thank you. Bye.